Is the first snapshot of the side effects experienced by people who have actually received the vaccines since mid-December when they became available. This CDC report released Friday shows that out of nearly 14 million people in the U.S. vaccinated during the first month of the vaccines, fewer than 7,000 people, about 1 in every 2,000, experienced any side effects at all. Most of the side effects were minor and expected, achiness and fatigue that went away in a day or two. 640 people experienced serious side effects, and 113 of them died. Two-thirds of those who died were residents of long-term care facilities. The CDC says there's no evidence so far that any of the deaths were caused by the vaccines, but instead by underlying medical conditions unrelated to the vaccines.
They've not been able to associate deaths with COVID vaccine per se.
Dr. Richard Rothenberg with the School of Public Health at Georgia State University says the CDC report is important for people to see to show exactly what the risks are of taking the COVID vaccines, similar to the risks of taking any other vaccines or medicines.
Blood clots that can lead to death have occurred.
Like the risks that drug companies list in their commercials, like the risks printed on the bottles of over-the-counter medicines.
You're absolutely right that if you look at the potential side effects of virtually anything that we take, doesn't mean that the drug is dangerous. Somehow people think that perhaps zero risk is achievable with some things, but I can't think of anything that has zero risk. The thing that stands out the most is that both of them are extremely safe vaccines. It really is very good news.
And any evidence of any long-term effects, he says, has not yet emerged after months of trials and hundreds of millions of vaccinations worldwide so far, even as the CDC continues to try to find if there are any long-term effects.
I think it's patently clear that getting the disease is so much worse than anything the vaccine might be doing. And this is true for virtually every vaccine that we have, that the risks of disease vastly outweigh the risks of prevention.